I'm Josh Colton. I'm a physician at Minnesota Gastroenterology, and I'm here today to talk to you about hemorrhoids and how to take care of hemorrhoids and a new therapy that we have for hemorrhoids to eradicate hemorrhoids. Hemorrhoids are composed of vascular structures just inside the anus, and they're generally 3 columns, and they can protrude out and cause symptoms. There's no hard and fast rules on when you should go see your doctor for hemorrhoids. If you have minor symptoms that are infrequent, you probably don't need to see anyone. The over-the-counter medications are probably just fine. I would recommend that you take more fiber in your diet and drink more water and help modulate your bowel habits so that you're not having diarrhea, constipation, and that you're not straining. But if you have enough symptoms that it's irritating, that it's affecting the quality of your life, come see us. If you're having a lot of pain, if you're having a lot of bleeding, certainly come see us. Hemorrhoid banding is when the hemorrhoid is suctioned up into a suctioning device, and then a band is applied at the base of the hemorrhoid. Over the course of a few days to a week, the hemorrhoid tissue necroses or dies off, and then you're left with a scar there, and that scar prevents the hemorrhoid tissue from prolapsing out of the anus, and it reduces your symptoms. Hemorrhoid banding has been around for decades, but what's exciting is that there's been development in the technology where we can now provide banding therapy that causes less pain, is quicker, and has the same excellent results. I've been taking care of patients with gastrointestinal diseases for over 15 years, and I've never had a population of patients that have been so happy and content. I've gotten hugs from patients after treating their hemorrhoids. It's painless. You don't need to take any time off of work. You don't need to do any preparation. And it takes about 3 quick clinic visits. Sometimes you can get by with 2 visits. Sometimes you might need 4 or 5 visits. But typically it takes about 3 visits.
Well, my name is Barb Gambucci, and I live in White Bear Lake. I'm married, the mother of 4, grandmother of 2. I'm 68 years old. I've had 3 colonoscopies. They all showed that I had an internal hemorrhoid, non-bleeding. I didn't think anything about it. I just made a mental note of it because I've never had any symptoms. The last colonoscopy was in May of 2009. And in July of 2009, I started having some symptoms. I started having a prolapse after a bowel movement. Sometimes it would happen, sometimes it wouldn't. I didn't think too much of it at first. But then as the months went by, I started having a prolapse when we would go for a walk. We have a little pug that we take for about a 1.5 mile walk. And it started happening then. And I decided I needed to get in to see Minnesota GI. And so I made my appointment. I told my internist about it, and he said, okay, that I had a prolapsed hemorrhoid. I went on the internet to look at what is a hemorrhoid. I saw the different degrees, and I looked at the hemorrhoid banding and thought that I was probably a candidate for that. People never talk about hemorrhoids. I don't know anyone who's ever had the procedure done, so there wasn't anyone that I could ask. I was apprehensive, but I went in there with a mindset that I've got a problem, I hope he can help me. And I was prepared to do whatever was necessary. To this day, I am just amazed. There's nothing to it. Never was I uncomfortable beforehand. Everyone was very professional, very kind. I felt very comfortable. The procedure itself only took a few minutes. I had no discomfort at all, and I had none afterwards either. In fact, I had been a unit coordinator for Health East for 20 years, and I'd been retired for about 11, and I thought, could I have gone to work after having that done? I could have, without any problem. And you have to go more than once to have it completed, usually 2 to 3 times. I had to go 4 times, and my visits were 6 weeks apart. And that hemorrhoid is history. And so I urge anybody who has any symptoms to go in and get evaluated to see if you would be a candidate for a banding. I know now that if I had let it go on and tried to live with it, that I would have had to look at surgery as an option. And that, I think hemorrhoid banding is the most cost-effective way of handling the problem.
Minnesota Gastroenterology is a great organization, and they're always looking for ways to improve patient care. And hemorrhoid banding is just another good example of that. They look at a technology and see that it's safe and effective, and then they adopt it and improve upon the delivery of that care. Currently, Minnesota Gastroenterology is the only practice in Minnesota that offers this CRH O'Regan technique of banding. We offer at least 5 or more locations around the Twin Cities where you can get this done. You can either have your primary physician refer you into Minnesota Gastroenterology, or you can call us directly to help make an appointment.